Are we ready?
Are we ready, Baruch? Nobody touch it.
How long are you going to be talking now?
I talk pretty fast, so what do you think?
What, 15, 20 minutes?
20 minutes,
And
maybe
then we
questions?
Then we'll go into the room to go over the machine.
Yeah, this first
Okay.
part's pretty quick, So yes, we're going to go through the didactic. Again, I'm Casey. This is my first time presenting it as a newbie. So,
And I'm Laura. Yeah.
so I appreciate you being my guinea pigs, I guess. And thank you, Laura, for letting me
Of course.
attend your training and
Casey's
practice.
out in the Midwest, and we, when we start with the company, we have to get certified ourselves,
Right.
just like we're going to get you guys certified. And so this is part of it, doing the training. Yeah.
Yep, so
Yeah.
here we go. Let's see how this goes.
I want to make sure I know who everyone is.
Yes.
Kristen, Renee, Rebecca. Okay.
Where's my thing? Sorry. All right. So what we're going to do just on the computer will be the part one. So just kind of go over what miradry is, what the patient selection as well as considerations are. Bless you.
Excuse me, sorry.
No worries. We'll talk about energy selection, what patients can expect, the side effects, as well as the tools, bless you, for managing
Is it me?
patient expectations. Just
Like,
So miradry, it safely and permanently reduces underarm sweat, odor, and hair. It has lasting efficacy. We have high patient satisfaction. It's non-invasive, meaning there's no surgery, no cuts. We have a very strong safety profile, and there's minimal patient downtime. And with the software upgrade that Laura just did earlier, I know some of you kind of popped in. So that's actually, we'll talk more about this, going to shorten your treatment time too. The largest Axilla used to be probably an hour 15 to an hour 30. So you can do that in about an hour now too, because we've actually shortened the treatment time too. So, good.
So a couple of practical things when people say, well, what is miradry, or should I get it? A couple practical things that I add into this is, it is the first and only FDA cleared device that will permanently reduce sweat, odor, and hair. So there's nothing else on the market. Some of your patients may get Botox, which they've got to get several times a year for the sweating. It won't do anything for the odor or hair. So this is kind of a 3-in-1, a triple threat in as little as 1 hour. So that's a big selling point. That's usually when we teach the front desk. If they're giving information over the phone, just say it's a 3-in-1 device, sweat, air, and odor, and it is permanent. So you're going to get that permanent reduction of all three of those in about an hour. So when Casey said it's lasting efficacy, it actually is. So we are, with the microwave energy, we're destroying sweat and odor glands, which includes the hair follicles. So once they're destroyed, they don't regenerate. So you do, that's where the permanency and the long-lasting efficacy comes in. And then the high patient satisfaction, we actually have a 90% satisfaction rating on realself.com. And that's the highest of any device that's in any office across the U.S. So a lot of people frequently view Real Self, so that's a really good selling point to put out there.
Helps with those
can you say
patients.
one more time? You said first and only FDA cleared device that will permanently, and you said something.
Permanently reduce sweat, odor, and hair.
Oh, okay. Sorry.
Sweat, odor, and hair. And it is permanent because we're destroying those glands. So they don't have to come back every 3 to 6 months, etc. So we sell this as, I'm getting ahead, sorry.
No, you're
We
fine.
sell this as a 1 to 2 treatment because 90% of our patients are happy with one treatment, but you're going to get 10% that will need or want a second treatment. And that's for various reasons. One is if somebody's an excessive sweater, which is called hyperhidrosis, they're going to need another treatment usually. They're so happy with the reduction after one, but most likely they'll need 2. And then the other part of the 10% that might need another treatment, it's really based on our anatomy. So we're going so far into the skin, and it's very targeted in energy. That's where the majority of most people's glands are, but we don't treat 100% because we're not reaching the glands above or below that. So that's why we get around that 80, 82, 85% efficacy on average. So some people have just more glands above or below, so they might get less of a reduction in their sweat and odor, and those people might want another treatment as well. So it's all about setting up realistic expectations, which we'll go into, but just we don't ever want to say you're going to be bone dry after one treatment, because we are hitting the majority of glands in the majority of people, 90%, but not all of them. So, okay, sorry.
No, you're great. That's great. Thank you. So the system, miradry system, just to go along with what Laura was saying, it's indicated for the use and treatment of primary auxiliary hyperhidrosis and permanent reduction of unwanted hair in adults 18 and older. It's also, when you use for the treatment of hyperhidrosis, may reduce underarm odor, like Laura was saying as well. Not indicated for treatment in other areas. So we have to be on label, so do not use anywhere except for the underarms.
Yeah. I get asked that a lot.
Yes.
You use it in the groin, or I sweat in my back, or it's only for the underarms right now. They are studying other areas of the body. The hands and the feet. They were looking, we saw something in our recent meeting for the back as well, but none of that has been
Not FDA cleared.
included. So
Will be off label. So it's contraindicated for people that have a pacemaker or other electrically implanted device. Okay, smoothie time.
what are you making over there?
Are we getting smoothies? It's also contraindicated if anybody is on supplemental oxygen, as well as anybody who may have had like a prior reaction to like a local anesthesia, like a lido with epi too. And then it's not recommended for patients who've had previous auxiliary surgery.
So if someone's had surgery before to physically cut out the glands, which is very invasive, it's a big recovery. There might be, the reason we say that, scarring, and we don't know how the energy will transmit through that. So you might get asked, well, I saw online that miradry is for hyperhidrosis because that's our indication. And the reason that is, it's because when they first looked at the studies for the system, they only treated or included in the study hyperhidrosis people, excessive sweaters. They really wanted to see how well it worked. So that's what we got our indication on. So if you think about it, we treated the hardest to treat patients right from the beginning. So even though our message has changed, it's for anyone because everyone sweats. You might get questions from patients saying, well, I saw online it's for excessive sweaters. I really don't have that. You know, I'm just annoyed with my sweat, or I don't want to use deodorants because of the toxins and chemicals, or I just have odor. It's all the same thing. Our studies, we kept that indication because those were the hardest to treat patients, and we got a great level of efficacy. So if you get asked that, it isn't just for those excessive sweaters.
You don't want to have your dry cleaning bill be high and have white stains all over your black dress. Then, yep, it's for you. So.
What is brown hydrosis? What if you don't have the sweating, but you just have that odor?
Odor, and that's very common. Very common, because this is in other countries as well, miradry, many other countries. And some of the Asian countries, the focus is on odor versus sweat. So you can absolutely treat for that.
We weren't sure if it was just odor from sweat or it could be from brown hydrosis.
Yep, because it is destroying those glands, the apocrine and the eccrine glands, so the sweat and odor.
Okay.
So I actually had somebody ask me about, like, how do you know it's not doing anything with, like, lymph, or is it just because?
Yeah, because our energy does not touch our immune system or our lymphatic system at all. It's very targeted. It's only going that 2 to 5 millimeter range into the dermal fat junction where the glands are. So it's targeted. It's not spreading and it's not affecting that at all.
Okay.
Zero effect, yeah.
Thank you.
Sorry.
No, no.
Some other things to consider, health of the patient, if they're coming in sick or they're having a temperature, they're taking kind of any medication that may compromise their immune system, may be a good idea to postpone. The treatment, pregnancy is another consideration. Anatomy, any surgery, like lymph node dissection, maybe anything that's changed, that skin fat interface under the arms. Somebody with extremely concave arms too. Yeah, if they don't have a lot of fat under there too. Do you see that a lot?
Yeah, so
Okay.
you'll see very thin, athletic
Yeah.
Like
women, very concave, and doesn't mean they can't get treated. We use the high volume anesthesia because it provides a really nice buffer between the nerves and the glands, but it also inflates the area so we have more of a smoother surface because we want all 4 corners of our biotip to have even coverage. So it's just the matter of angling that. But so the contraindications were only 3.
These
All
are
of
just
these are
things to
practical. They
Yeah.
deal more with timing and angling, so they're perfectly fine to treat. But it's just you'll see very concave or the reverse. You can see folds from someone, and it's just kind of your angling.
Yeah. Yeah, and I even had a clinic tell me they just had, with somebody who had more folds, they had like 2 people in there, and one was kind of holding,
Yeah.
smoothing those out, and the other was treating
Yeah.
at one
So you
point
can,
too. So
okay.
they did do it that way.
So these are
Yeah.
just practical. They're not contraindications.
So yeah, patients with little to no subcutaneous fat, basically what we were talking about. And then more practical reasons. So if somebody's getting married next week and they're wearing a sleeveless dress, they probably will have some swelling and probably not the best time to do it. Or if they're going to be doing like a lot of travel too within a week of the treatment, like me. If you're going to be on 4 flights in a week,
Not gonna
yeah, it may not be the most comfortable to be a little swollen and have that middle seat. And yeah, have to deal with those
Oh
people
my
on the right and the
gosh.
left. So just practical
Oh my
things.
goodness, I didn't know that. That's
What?
so funny.
Huh?
So you had that done, and you.
No, I didn't have it done. I'm just
Oh.
saying, if you're a little
Oh.
swollen and you might have to be on the 4th flight for the week and you're in your plush middle seat,
That's
you may
right.
not be
Yeah.
the best time to get miradry, and then you're trying to ice and you've got the people on your right and left, and yeah, so. Yep, so just kind of practical things to consider too as far as timing goes.
So you say like up to a week is where like it really.
Yeah, I mean
the
that's what they. I mean,
downtime.
if it's like rigorous, travel, if they're to having a crazy schedule like I did this week, I probably wouldn't have had miradry done. I'd probably do it where, and people go back to work. I mean, same day even. So it's more of a okay. Are you going to be, able to ice that and stuff like that? So it just depends on what your schedule is like too. So.
And I'm sure you see with your other procedures that you do here, everyone's different with
Yeah,
your
that's
level
what
of swell. Like I swell with everything.
Yep.
I bump my arm, it's swollen.
Oh, I
for a
bruise
week.
with everything. I could
Yeah,
bump the
and
table and I'll bruise.
I have friends that, nothing. So I've seen people the day after this treatment, hardly any swelling,
Yeah.
like good to go. And I've seen people that are like, I'm so swollen, I'm so sore. So everyone's different.
Right.
At least a week.
To
Those
say,
first
yeah.
few
Say at
days,
least- Okay.
like the next day is the worst. And then it gets better. after
yeah.
that. But
Right.
the icing is the key with this procedure, ibuprofen icing. And we really want that, which is, I'm getting ahead again, but
No worries.
that 24 to 48 hours of icing.
Icing, yeah, it's going to make a big difference.
Yeah, and we'll talk in our training about some tricks with the icing too you can utilize.
Energy selections. So there are 5 energy levels that are available, 1 through 5. The first one was used in our dry up study, energy level 1. and it resulted in a 70% efficacy at 2 treatments. And then energy level 3 was used for the Canadian study, so higher level of energy, and then that resulted in 90% efficacy after from 1 to 3 treatments. I was going to ask you a question, Lauren, I just forgot it.
Oh.
I forgot what I was going to ask you something about
That's
that
delicious.
too. So just yum, is that coffee? Got distracted.
Avocado toast?
Yes,
yeah.
Oh, it's delicious.
So based on that, those 2 studies, higher energy levels may provide a higher efficacy too in patients. And those, I don't know, do we touch on like why, the energy as far as like HVA that was not used in those studies or?
Yeah,
Yeah.
so they started off with the lowest energy level in the initial study,
Okay.
and they thought, wow, 2 to 3 treatments, and they were just using an old protocol with just almost like with Botox, just all
just little,
the injections with lidocaine, and they saw, wow, we're getting 70%, and then they bumped it up to level 3, and we're like, wow, now we're getting higher levels. So now we give you the option, but we train on using the highest energy level because we don't use that old protocol like the Botox protocol. We don't use that anymore. We use the high volume anesthesia because again it gives us that nice buffer. So we are able to go up to the maximum setting. And so these are just kind of the history and
Of the studies and
Yes.
showing how the efficacy improved the higher the energy went to. So, so that would be determined by each patient's subcutaneous fat sensitivity, desired results. So, when energy is selected and locked, the first few rows would receive an energy level of 1. And that was because with the brachial plexus nerve is more shallow in the superficial part of the axilla, too. So it was set at energy level 1. And again, that wasn't that before the HVA?
It was.
Yeah.
It was, of course. So the system has a default. It automatically defaults to energy level 1 for the first few rows. And we show you how to unlock that default.
If that's
very, very simple.
something you decide you want to do for those piece rows that are all getting the same energy level. So patients can expect a reduction in underarm sweat after the first procedure. They're also going to have permanent results in as little as 1 treatment. Like we talked about, everybody is different. So some people may need more than 1 treatment too. Sweat glands are destroyed. They do not come back. And there's a significant reduction of underarm sweat. So on average, about 82% underarm sweat reduction was reported. And also a reduction in hair and odor. So that triple threat. Sweat, hair, odor. All in one.
Those were, odor and hair were side effects in the original study, even though they were good
Side benefits,
effects,
yeah.
They
So
were
they were
labeled as
like-
side effects, so then we did the studies and got the FDA clearance for those as well. So they're all benefits
Yep.
now.
It's not always a positive hair. We just lost a patient because he didn't want to lose his hair.
It's the guy.
So male hair, so women notice a big difference, that average of 70%. Men have so much more volume, it fills back in.
With 1, it's just,
It might be
it might be a while.
slightly thinner, but honestly, I haven't had a male that's noticed the difference. Women notice the difference. So I might call him back. He shaves for it, but it'll grow back in.
Someone that's already been
Yeah.
like previously treated for laser hair under their arms.
What is it?
Like if someone's already been previously treated for laser hair, it doesn't matter.
It
right?
doesn't matter.
Okay.
They
Okay.
still can, yeah.
Okay.
Yeah, they can
Yeah.
still have it.
Now the one that I sat in on Channing did a gentleman who, and this was his second treatment. So he said after the first, he was like, it was great for like 6 months, no sweat. But then he started sweating again, and this was like a year later. Is that like, why would that be?
That can
Okay,
happen.
okay.
But
I mean, he was happy
So,
with it, but he just wanted the
your
second.
new baseline is 3 months from your treatment.
Okay.
So Channing's going to get treated, what are we, February?
Yeah.
March, April, May. So towards the end of May will be her new treatment. The first 5 to 14 days, you have no sweat or odor.
Okay.
And as your swelling goes down, you increase, getting to your new baseline, sweat and odor will come back. So our average reduction is that 82%. That's average across the board.
Okay.
Some people get higher, some people get lower. So at that point, when somebody says like after their, and I'm getting off track, but
Yeah,
after,
sorry.
no, after their 3-month mark, their new baseline, if someone says, or even this guy, hey, I'm thinking about a second treatment, bring them in. We do, and we'll send you the information, a starch iodine test on them outside of the area.
Okay.
So it's all the way out here.
Okay.
And we see where they're really sweating because 90% of these that I personally performed, their sweat, especially with men, they're sweating up here.
Okay.
and
Yeah.
That
around,
makes sense.
And it's migrating in.
Yeah.
That makes sense.
And then the middle might have a couple of little, the sweat turns black, a couple of little spots. And when you show them, I had a very unhappy patient in,
Yeah.
in Michigan, and he wanted a third treatment. When I showed him with the
Where?
mirror, you are crystal clear
Okay.
in your
It's-
underarm where
yeah.
we treated. I said, look where
Your
you're
face mirror, that
sweating, and
makes
it's
sense.
migrating in. He said, oh, and he was happy and he
Yeah,
understood.
okay.
So it's showing them. Plus, we do that to show them, but we also do it to see if it's even going to be beneficial. Because if someone's clear, it's not beneficial to them to
No.
pay the
Yeah.
money and get a second
Okay.
treatment. But if you see areas in there, absolutely,
Okay.
let's do a second
Okay.
treatment.
Oh, that
So
makes
for someone
sense.
like that, I would bring back in if he wanted a second treatment and do the starch iodine first.
The sweat test. So you're saying, so they should say within 15 to 14 days, you'll see an 82%
No.
less.
Within the first few days after treatment, up to 2 weeks, because your glands are stunned and you're swollen, they have none. And
So you're like,
as
"Ooh."
the swelling
Oh,
goes
so
Yeah.
they have
away,
none and then
Yeah.
you have an
Right.
82. Okay.
right,
And 3 months is the new baseline.
after their baseline.
Yeah.
So after 3 months, it should be 82%.
That's the
The average.
average.
Okay.
You don't wanna say you'll get, don't ever say specifics because
No.
everyone's different. So
Yeah.
that's
Yeah.
the average that patients get. Some get much better than that, some get less, depending on their anatomy. But that's kind of what you can expect. Does that make sense?
Yes, yes, it does. Thank you.
Okay.
So pre-procedure prep. So we instruct patients to shave 4 to 6 days before the procedure. That way you can see the hair-bearing area, so you know what area you're going to be treating. If they, let's say, shave like the day of, that you would just tell them reschedule for that, or do you do?
No, so
Okay.
I actually changed this.
Okay,
For
because I know
men-
I've heard different things. So I was like, I'm going to ask
so
you.
4 to 6 is our protocol. Practically, I say 2 to 4 for women, 2 days for men, because there's more volume and it comes in faster.
Okay, yeah.
Or if you have a hairy patient, bump it down to 2. We want to be able to see the hair-bearing area, if possible, with laser hair removal. That's still not a
yeah, because
deterrent.
it's different. Yeah.
But we don't want even a quarter of an inch of hair because it gets in the way of our templating and we can't see the template clearly. So that's why. Has nothing to do with the efficacy. If someone doesn't shave, they can shave here, but they need to use like soap or shaving cream, not a dry shave, because another reason we do it ahead of time is if they have any nicks, they
Yeah.
heal. So there's less risk of infection or any irritation. But I just bumped that time period
That's
down.
okay. I know that's how
'Cause I
they
run into
trained us was
even
4 to 6,
women-
but I had heard people
Women
say, "Yeah, you don't
say,
have
well,
much
I
time." Like,
shaved
I'm gonna
6
ask you.
days ago, and there's like
A ton
yeah.
of hair.
half an inch.
Yeah,
Yes.
yeah. Well, that's
So-
what I was thinking too. I would be like really hairy.
I just bump it down because as long as you can see the area or gauge it, you're good. Yeah,
Cool.
that's just me practically.
Yeah, no,
So
very
if they
different.
have had hair removal treatments and don't have a lot of hair, What were you said something about, is this gonna be effective? this
Well,
time?
she asked if
sorry,
we can
30
still
minutes.
do treatment
Yeah.
on someone that's had laser hair removal. Absolutely. Because we're still working on sweat and odor.
Right,
So
so
is that-
then
okay.
how do you mark, like, you don't really have anything to define?
We still, even though we see a hair bearing area, we still use, which will show our tools to measure. Because everyone's a different size. It has nothing to do with your body size. The biggest man I've ever seen treated had the smallest armpits I've ever seen in my life. So it has nothing to do with your size, but everyone has a different size armpit, and they can be different sizes on each of
Okay.
us.
Yep.
Okay.
Not always
Hi.
symmetrical. And just practical too for the day of treatment. Women, we usually recommend wearing like a tank top or sports bra or something where the area is easy access. Men can wear no shirt or a tank top as well, which is something that makes it easy to treat.
And just a practical thing I've seen, I don't recommend sports bras for women.
Okay.
Okay.
Because if they're larger, a sports bra
Yeah.
flattens, and oftentimes they have to hold
Gotcha.
out of the
Okay.
way. Even though that's what we recommend, it's just
So
something
do you just
I've
do like a
seen.
regular bra and
A
tank
bra
top?
and a tank top
Okay.
is perfect. Yeah, men can be in a tank top or shirtless. It's just a practical thing
Right.
I've run
Cool.
into.
Good, yeah.
Because you don't want them having to hold
Yeah. That's
Oh, no.
themselves the whole time. Yeah.
Good points. Post-procedure care. So all patients experience side effects which are pretty common: swelling, soreness, maybe an altered sensation in that area. No rigorous activity for several days. That probably will vary from person to person. So, but we just say several days post-procedure.
People will ask you if
How
they
many
can.
are?
Well, a couple
Yeah.
people were like, "Why? I want to go to the gym today." I'm like,
Yeah.
"Don't you just want
Take
to
the
go home
day
and
off.
relax,
Relax,
so
Just
right.
go ice and watch some
Ice
soap
Yeah.
operas.
Lifetime. No, I need
The
to go to
Hallmark
gym.
Channel's
Right.
calling you.
Yeah.
So what can I do? And I'm thinking, all right, you don't want. It has nothing to do with efficacy, but they're swollen.
Right.
And if you're on a treadmill going like this, it might lead to irritation.
Okay.
Perspective.
Oh, thank
So I
you.
printed this out, but I can get you an official one more from them. This doesn't say where we went though. But I can get one when I go pick it up.
Yeah, I'll just attach both of them. That's
Yeah.
perfect.
Yeah.
Thank you.
You're welcome.
Thanks so much.
I'll keep this until I bring get the other
Okay,
one. And then
perfect.
I'll just cook them for you.
Thank you so much, Lisa.
12:30 I'm picking it up.
Okay.
You think that'll be a good time?
Well, we'll go ahead and get started.
Or what time do you want me to get it? I can call them back if you want it sooner or
What
later.
time is
It's
it?
about 11:30 right now.
Okay, because we
Or
want
is
to
that
mix
right?
up
Yeah,
the,
I'm on the anesthesia.
Because I just placed it, so I can call them back and tell them I want it later or sooner.
It's 11:30.
So I think it's
Yeah, it's
close.
11:30.
Okay. I'm on Central Time. That's why I had to
Oh.
double check.
All right, do you all want to eat before we get started with the procedure?
I have to leave pretty much on time. If everyone wants to eat, that's fine, but I have to leave like no later than 1.
Oh, okay, because we won't be through the procedure by 1.
Okay.
Yeah,
I-
it doesn't start until what time? 12:15, right?
We'll just work around.
Yeah, we'll just
lunch.
yeah.
Okay.
I
I'm
mean,
gonna
I
have
put
lunch
it,
here
yeah,
for
just,
you.
yeah, you guys eat.
We'll
Yeah, yeah.
Because we need to get started,
Yep.
and we'll just work it in.
So, but the
whenever-
the PA has to be. Do you need the PA time changed? We have her blocked out at a certain time.
What time?
I'll go check that out. But that's going to be a deciding factor too. Or maybe I can get Dr. Ringfile to hop in if that.
So we
becomes
can
an issue.
start. We can start with the numbing at 12:15. Let's say.
Let me go see what the time is. I have her blocked out.
Okay.
And then I'll come right back. Okay. All right.
Sorry. I thought it was done at 1.
1:30. Oh, right.
But that's. I just have to
We'll go through the system. We'll get started
yeah,
with the numbing.
we'll-
Who mixes up the solution? The anesthesia.
The PA and her medical assistants. We pretty much just do the procedure.
Okay.
So they handle all that.
Okay.
So yes, icing is pretty crucial for the first 24 to 48 hours. I recommend putting it in a bag and then wrapping it up with like a towel or something. Especially like the first day because they may still be numb from the anesthesia, so that way they don't get frostbite. And then also taking ibuprofen too to manage the pain. Was it 20 minutes on, 20 minutes off icing?
Yes.
Yes.
Okay.
Okay.
You want to try and get them to do that for 2 days.
Yep.
If you can. Definitely the first 24 hours. One thing you can do is freeze the small water bottles So if you're sitting
Yes,
at a desk,
love that.
or driving, you don't have to keep switching them because they stay frozen a long time. So you don't have to keep getting up
That's a
and
good idea.
Yeah.
freezing.
Okay.
Yeah.
Write that down.
20 minutes.
You just put like plastic water bottles in the freezer.
Mhm.
Cool.
Because like our